Hello, and welcome to our channel, Lifelong English Learning Academy. This is day 3 of our 30-day vocabulary challenge. Each quiz focuses on a different subject. Today's focus is body and health words. All questions are designed according to the Common European Framework, elementary, intermediate, and advanced level. You have 5 seconds for each question, and if you feel like you need more time, please pause the video and take your time. You will see the answers after each question. If you are ready, let's start. Question number 1. After a long day of gardening, she had a ache. A. Brain. B. Eye. C. Back. D. Tooth. The answer is C. Back. After a long day of gardening, she had a backache. Question number 2. She gave blank to a baby girl yesterday. A. Birth. B. Body. C. Health. D. Heart. The answer is A. Birth. She gave birth to a baby girl yesterday. Question number 3. Stress may cause blank. You need to rest. A. Bandage. B. Medicine. C. Toothache. D. Headache. The answer is D. Headache. Stress may cause headache. You need to rest. Question number 4. You may catch a and blank in this freezing weather. A. Accident. B. Pain. C. Cold. D. Ache. The answer is C. Cold. You may catch a cold in this freezing weather. Question number 5. He needs to take his blank twice a day. A. Medicine. B. Headache. C. Toe. D. Pain. The answer is A. Medicine. He needs to take his medicine twice a day. Congrats! You passed the elementary level. Question number 6. The nurse checked the patient's blank to monitor for any signs of fever. A. Shoulder. B. Operation. C. Temperature. D. Illness. The answer is C. Temperature. The nurse checked the patient's temperature to monitor for any signs of fever. Question number 7. The blank was waiting for the doctor's examination. A. Surgery. B. Patient. C. Constitution. D. Disease. The answer is B. Patient. The patient was waiting for the doctor's examination. Question number 8. Vaccines play a crucial role in preventing the spread of infectious blank. A. Surgeries. B. Operations. C. Fever. D. Diseases. The answer is D. Diseases. Vaccines play a crucial role in preventing the spread of infectious diseases. Question number 9. Never forget to use sunscreen to protect your blank when you go out. A. Skin. B. Wound. C. Bone. D. Chin. The answer is A. Skin. Never forget to use sunscreen to protect your skin when you go out. Question number 10. Maintaining a balanced blank is crucial for good health. A. Fitness. B. Diet. C. Breath. D. Sight. The answer is B. Diet. Maintaining a balanced diet is crucial for good health. Question number 11. The sudden blank of the immune system led to frequent illnesses. A. Consciousness. B. Treatment. C. Breakdown. D. Cure. The answer is C. Breakdown. The sudden breakdown of the immune system led to frequent illnesses. Question number 12. You can expect a gradual blank after the surgery. A. Reaction. B. Recovery. C. Remedy. D. Stroke. The answer is B. Recovery. You can expect a gradual recovery after the surgery. Question number 13. Blank is one of the symptoms of food poisoning. A. Liver. B. Poison. C. Vomiting. D. Scar. The answer is C. Vomiting. Vomiting is one of the symptoms of food poisoning. Question number 14. After fainting, it took a while for her to regain blank. A. Consciousness. B. Condition. C. Treatment. D. Sickness. The answer is A. Consciousness. After fainting, it took a while for her to regain consciousness. Question number 15. Access to healthcare is crucial for the blank of the community. A. Skeleton. B. Bruise. C. Sensation. D. Welfare. The answer is D. Welfare. Access to healthcare is crucial for the welfare of the community. Congrats! You passed the intermediate level. Question number 16. Regular exercise and a good diet improve blank and overall fitness. A. Spine. B. Stamina. C. Germ. D. Healthcare. The answer is B. Stamina. Regular exercise and a good diet improve stamina and overall fitness. Question number 17. Eating slowly and consuming food rich in fiber can be beneficial for blank. A. Pregnancy. B. Posture. C. Digestion. D. Vein. The answer is C. Digestion. Eating slowly and consuming food rich in fiber can be beneficial for digestion. Question number 18. Some medications may have mild blank, such as drowsiness. A. Side effects. B. Pulses. C. Attacks. D. Consciousness. The answer is A. Side effects. Some medications may have mild side effects, such as drowsiness. Question number 19. The psychologist specializes in treating eating blank. A. Reactions. B. Surgeries. C. Disorders. D. Germs. The answer is C. Disorders. The psychologist specializes in treating eating disorders. Question number 20. Poor dietary choices and lack of exercise contribute to blank. A. Blindness. B. Obesity. C. Pregnancy. D. Well-being. The answer is B. Obesity. Poor dietary choices and lack of exercise contribute to obesity. Question number 21. A healthy lifestyle can contribute to increased blank. A. Longevity. B. Complication. C. Mortality. D. Starvation. The answer is A. Longevity. A healthy lifestyle can contribute to increased longevity. Question number 22. Breathing exercises involve inhaling deeply through each blank. A. Skull. B. Nostril. C. Rash. D. Joint. The answer is B. Nostril. Breathing exercises involve inhaling deeply through each nostril. Question number 23. Advances in medical technology have significantly improved the accuracy of disease blank. A. Circulation. B. Sufferer. C. Diagnosis. D. Resistance. The answer is C. Diagnosis. Advances in medical technology have significantly improved the accuracy of disease diagnosis. Question number 24. The doctor recommended plenty of fluids to relieve the effects of blank. A. Diarrhea. B. Mortality. C. Rash. D. Labor. Question number 24. The doctor recommended plenty of fluids to relieve the effects of diarrhea. Question number 25. She struggled with blank, finding it difficult to fall asleep at night. A. Joint. B. Wreck. C. Knuckle. D. Insomnia. The answer is D. Insomnia. She struggled with insomnia, finding it difficult to fall asleep at night. Congrats! You passed the advanced level. This is the end of our video. Thank you for watching us. Please subscribe to our channel if you want to support us. Check out our other videos.